and Dr. Tejas Shah will be presenting first. If your children are non-ophthalmologists or non-medicos, a big problem.
Thank you, Dr. Rajan. Well, very sorry, but they have put me in as a judge in another session, and that's the reason I'm trying to rush. And it was my bad that I did not see the times properly. I thought this was not overlapping. So, well, beyond 60 and no kids as an ophthalmologist, that was a topic given to me. First of all, let me tell you, I'm not 60. Okay, so don't overestimate me. I'm not yet 60. Well, now, any planning you would have already understood when you are 50 or 55 that your children are not going to be an ophthalmologist. Correct? It is not that at 59 years and 362 days that you know that your kid is not an ophthalmologist. So your planning has to start probably around 50 or 55 when you already know that your kids are not. Well, I have two daughters. One is in USA married, and my second one, she is given a plab and she is going for a psychiatry. My wife is a dermatologist. Can you see silk skin? We have a very huge practice. We have our own building, but my daughter doesn't want to join us, so we cannot force her, right? So planning. That is the most important thing that you should be doing. Now, what kind of a planning that we should be doing? It should be in three different groups. One is financial. The most important is financial planning, because if you have money, your physical and mental health is definitely going to be better, but not vice versa. You might have good physical health or mental health, but no money. Well, that also is not a good idea. So to me, financial planning and independence is the first, then a physical planning, then a mental independence. And frankly, at this point of time, your planning should be such that your life is beyond money, right? And what is there beyond money? Well, you want to be happy, correct? Everybody wants to be happy, and especially more so because you have more time after 60. And so beyond money, what you have to think about is happiness. Now, let's see some different scenarios for each one of us. For example, I'm in a private practice, but for me an advantage is that I'm in a group practice. So my thought process will be different. What would be an ideal condition, which is what I think about myself, that I should drop dead in my clinic और वहीं से ले जाओ मेरे को. That would be the most ideal condition, but well, that might not actually happen. So what are the options that you have? Well, you can gradually close and dispose of your things and then think of something else or join another place. You can sell your practice and be an employee, right? A lot of chains are now taking over your practice, and you can choose this, but this is going to be very, very difficult once you are above 50, 55 and you had a roaring practice and you are your own king. So sell and be an employee. I'm actually not actually pursuing that idea, even though a lot of offers come to me. Well, I might wilt under pressure. To me, the most important thing is pass on the baton, right? We have worked so hard to create a small, whatever kingdom that you may say, a very small one, right? 1 CR, 2 CR, 5 CR, 20 CR. But that is your baby. Understood? Right? It is your baby. So what should we think? And what is my group thinking at the moment? We want to give it back to the society. And what better than giving it to our youngsters? So we are actively pursuing since last 2 years to rope in youngsters. And our advertisement says that Ahmedabad Eye Laser Hospital wants a partner, not an employee. We want a partner. You join us. We don't want any investment from you. We have already invested. We are flush with money, but you have to give your commitment. So the commitment is that you work with us for 5, 10 and forever. Once you join our organization, you cannot leave the organization. You cannot practice in the city of Ahmedabad. That is the only condition that we have for them. And we don't want any money from you. In fact, as the number of years pass, you will start getting a percentage. Ours is a private limited company, so we'll start getting percentage. And that is how we have planned to go ahead and give our pass on the baton. But these decisions are also based on a lot of other variables, like whether your spouse is an ophthalmologist or not, whether the spouse is a doctor or not, whether the spouse earning is more than yours. Well, because I'm talking about both the genders. So it might be a case that the spouse might be earning more than you. Well, in that case, it is very easy because you are shutting down something which was not the primary income. Understood? This was a secondary income. So when you have a primary income and when you're shutting down, it is very important that a planning has to be done. I'm just going to play a small video clip about money.
We are so close to all being together. We can sense it. Heartbeats come out of our chest. We taste true friendship again. A scent that says, I love you. And hugs and kisses from childhood friends. Getting closer and closer together. Priceless. MasterCard is creating priceless surprises every day by giving away reunion trips. Learn more about the vaccines and start something priceless.
Agreed? We have to create memories which are priceless. And probably these memories will allow you to live a more respectable life, but ultimately you need money, right? And a good planning only will allow you to actually live very happily even after 60. I would say with a kid as an ophthalmologist or without also. Warren Buffett very rightly said, if you don't find a way to make money while you sleep, you will work until you die. And this is not what we want, right? Sensex is high, gold is very costly, properties are not affordable, and banks are not reliable. Well, this is a time when a lot of banks were also going down. So relationships, feelings and friendships, this is what we should have when we are beyond 60. Well, your relatives might desert you, but your friends are never going to desert you. And I always say, and colleagues, sorry, I would also say colleagues, especially if you are well traveled, like, you know, in my CV, my hobby is traveling and making money. Well, these are my, but the bottom line is traveling, making friends and making money. And beyond 60 or even before that, you should start helping others, because that satisfaction is even more than money. The satisfaction of having help. And that is the reason we do not want to sell our hospital to one of the chains. We want it to be given to some few youngsters. And that is how we want to help others. Well, you have to think about all these things also beyond 60. You have to be happy. You have to do all these activities beyond 60. But for all these things, what do you need? Money. Well, you can have your vacation at this age and at this age, both ages, correct? Well, you choose whether you want one or whether you want both. Zindagi na milegi dobara. Sir, 60 or not 60, understand, we have to live our life. And I will end with a very nice quote. Well, this is my life. Well, that is, we are, you know, Ahmedabad is known for three things. This is Uttarayan, the kite flying, right? That is me and my wife. This is Garba, the Navratri. That's my daughter also with us. And well, this is our 31st December dance party. So these three things are always, we are the host for all these three things. Well, so what happens is, I'm investing in relationships, in friends and colleagues. And that is what is going to help you when you go beyond 60, whether you have a kid as an ophthalmologist or you do not have a kid as an ophthalmologist. This lovely, my daughter of mine, she's given her pleb and she's going to pursue psychiatry in UK. We are awaiting her results. I was in Kolkata last month for her pleb exams. Well, these are our friends. These are 20 people with whom we have breakfast every day in the morning in the club in Ahmedabad, if I am in Ahmedabad. Right now they gave me a call, when are you coming back? Right? So this is all we need when we go beyond 60. Not that we need it only after 60, we have been doing it since now 20 years. So yes, we also, I believe you all know that SSTC was my brainchild. Well, and now it has taken over everywhere as a training. But so this is also our way of, if you cannot actually perform a surgery, teach, right? And money. This is something which is unbelievable. Please listen to this.
It's amazing how money can be known by so many different ways. In a temple, church, or charity, it's called a donation. In a school, it's called a fee. In a marriage, dowry. And in a divorce, alimony. When you owe money to someone, it's called a debt. When you pay it to the government, it's called a tax. In a court, it's a fine. When you receive it regularly after retirement, it's called a pension. When an employer gives it to a worker, it's called a salary. When a master gives it to a servant, it's called a wage. When children receive it, it's an allowance. And when you borrow it from a bank, it's called a loan. When you offer it after a good service, it's called a tip. When paid to a kidnapper, it's called a ransom. When illegally received in the name of a service, it's called a bribe. And when used to share and to serve others, it's called happiness. There's nothing wrong in possessing money. The problem is when money possesses you. Earn more money, fulfill your needs, utilize your money to share and serve others, and transform the value of your money from currency to happiness. Thank you.
And so I end with my presentation here. What is happiness and what is life after 60? Well, you should be able to do something that you want to do, but you should have time and money to do. Well, more important is you should be able to do. Correct? And for this you need financial, you need physical, and you need mental happiness, and only a good planning from 50 or 45 or 40 will help you do this. Forget about the kid as an ophthalmologist, right? Thank you. Sorry, I have to rush
Thank you, Dr.
to another
Tejas.
session.
That was wonderful. And we wish we had a club like you.
You can create one.